So as with every year, the Council awards an important recognition for the work that individuals and organizations do around the country to elevate, promote, and champion language access. This year, I'm happy to present to you the winner of our Individual Language Access Champion Award, and her name is Melinda Parras. And Melinda was the founder and CEO of Parras and Associates, and leading the implementation of new language access solutions using video call center technologies. And the Parras and Associates team created the Healthcare Interpreter Network, also known by its acronym HCIN, which is a cooperative of hospitals and clinics sharing interpreter services over a shared video platform. And she has since retired after selling the company to its employees. And Ms. Parras is a former president of the Alameda County Medical Center of Trustees and a former San Francisco Health Commissioner. Melinda's also served as the executive director of the National Gay and Lesbian Task Force in Washington, D.C. And she also served as executive director of Health Access California, which is a not-for-profit dedicated to improving healthcare access to underserved communities. Now, I have had the pleasure to know Melinda since my days back when I was a board director and eventually president of the California Healthcare Interpreting Associations. And she may not know this, she may not remember this, but I do remember that one day we were having a conversation. This was many years ago. And she said to me, I'm always ready to listen to new solutions if they are smart. And that really stuck with me over the years. Melinda is the true definition of an entrepreneur, an innovator, and a visionary. And those titles come with a lot of risk, especially as an innovator. You need to come with a concrete, solid belief in your idea, because most likely you will not be understood and you will face a lot of pushback from people who do not share your belief and ideas and who do not see as far as you do. And so it's much easier to blend with the trend, and it takes a lot of courage and moxie and extraordinary vision to break from the trend and create something truly unique. And of course, let's not forget her respect and appreciation for all interpreters, whether employed or freelancer or independent contractors. And did I mention she sold her company to employees? What do I need to say more to describe Melinda's depth of soul? So it is with enormous joy for me to recognize you, Melinda, as National Champion of Language Access. And thank you for all that you have done with your smart solution, allowing a network of hospitals and clinics to support each other where language access is related. And that has allowed to expand access to care for many patients with vulnerable communication. So I'm going to leave some time for you.
Well, thank you so much. And I'm very honored to receive this NCIHC Language Access Champion Award. And I'd like to congratulate the National Council on Interpreting in Healthcare for all of its wonderful work boosting the professionalism and recognition of healthcare interpreters. As you see from my introduction, I did not come into this field as an interpreter. I began my involvement in healthcare interpreting as a hospital administrator. As a health commissioner in San Francisco and as president of the Board of Trustees of the Alameda County Medical Center, I observed the limitations of our systems providing timely access to qualified healthcare interpreters. I began the exploration of how to use the emerging technologies of video interpreting to bring instant access of interpreters to the bedside in the public hospital systems where large numbers of uninsured immigrants sought care. Together with a fabulous team of colleagues, we created the Healthcare Interpreter Network, a system of shared video interpreter services among healthcare providers. We held several principles in designing the system. We sought to have healthcare systems hire their own staff interpreters to provide stable, well-paid positions for healthcare interpreters. The HCIN fosters insourcing to use US-based qualified healthcare interpreters rather than outsourced unqualified interpreters in other countries. We sought to use the shared system of interpretation to allow healthcare providers to hire interpreters in less requested languages because they could share their Vietnamese, Hmong, and Russian interpreters with other hospitals and recoup some of the costs of their employment. And we sought to develop a shared system of resources to reduce costs and yet offer the highest quality of care to patients, allowing hospital systems to significantly increase access to qualified interpreters. I would like to thank the wonderful members of my team from HCIN and from Paras and Associates, who have been a joy to work with over the last 16 years. I retire in the faith that HCIN will continue to further our common goal of ensuring that every patient encounter of LEP persons in the US will receive the assistance of a qualified healthcare interpreter.